Take a deep breath in and breathe out. Another breath in and breath out. Go to the center of your heart and invoke the healer within you. And let's all embrace this mantra. Namami dhanvantarim adidevam surasurairvandita padapadmam loke jararukbhayamrityunasham धातारमीशं विविधौषधीनाम् ॐ गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरः गुरुः साक्षात् परं ब्रह्मा तस्मै श्रीगुरवे नमः. All right. Okay, we have a cozy group today. If you feel like you wanted to turn on your camera and come off the camera, you're more than welcome to. But if not, if you're driving and if you're cooking, if you're doing something else, it's absolutely okay. This week we were going to do women health again because we felt like there were many questions unanswered last time. I know we spoke more about puberty last time, menstruation last time, but we did not get a chance to talk about perimenopause, menopause, and how is it that we need to take care of ourselves after menopause, post-menopause. So, like we've mentioned last time, it is more about what we did during our menstruation years, what we did right at puberty, during our menstruation, how did we protect ourselves, and how did we land up in our 40s or when we get to the perimenopause, right? And we all have to remember that as women, we all have a lot of soma tattva, which is the moon energy within us. You know, that there's a lot of curves, there's juices, there's everything. It's like the women are known to have all of these flowy juices, and we're that is exactly why we are compared with moon, right? So moon is also going to affect how our cycle is going to be. Now, with that in mind, we have to go back and look at how much depletion has been happening. If we're depleting this juices within us, this soma tattva within us, then we are drying ourselves much faster. And when that drying happens, we can get to the vata stage of our lives much, much faster. I remember we were in the kapha stage of the life when puberty happened. That is one transformation. We spoke about how the eggs are always there within our, I mean, at birth, we have all the eggs that are needed. And those eggs deplete at the time that we come to even puberty, right? And when we come to our 20s, 30s, and 40s, they continue to deplete even further. But it is just that transformation is happening. The seed has sprouted when puberty has happened. Then the next stage of transformation is when this perimenopausal stage to the menopause stage. Now, technically, the term is if you have not had a period for 12 months, the day 12 months after your previous period is technically considered to be your menopause, right? I mean, you've menopaused by that time. So that's a technical terminology. Now, which means that your body does not have any eggs anymore, any eggs, and it is getting ready to the Vata stage of the life. Does that mean that we've aged and we've reached a stage that we are saying that we've already aged? No, because that's only half of our life. We cannot live half of our life saying that we're already aged. So that's very important for us to remember. And last time when someone came to the clinic and we were just having a conversation, and this client of mine was very happy. I mean, even before she was talking about herself, every time she comes in, wait, you have to look at my grandson's picture. I mean, he must lighten up your day so much. I mean, he does this, he does that, and she's excited to share about her grandson's adventures, and he's only like few months old. So I could see that spark in her eyes, right? And then she says, what is this for? I'm here only to pass on all this information to my grandson. So that is what menopause is for. And there are only three mammals that are alive even after menopause, even after all the eggs are depleted. That's whales, elephants, and humans. And the reason that is there is because traditionally you've always seen that mothers are the one who pass on the information to their kids, and that is passed on to the next generation. This is how, they always say Ayurveda is a grandma medicine. They wouldn't say grandfather's medicine because we always, it's as a grandma wisdom, right? That's what we always look at. And that is exactly what we have to consider menopause as. Embrace it. Of course, all these things that happen before it is like the tsunami that happens before it, all the changes that happen before it, only because that is again another change in our lives where, the plane is taking off. And when with puberty, what happened is it was on the ground, it was taking off. And at that time, there was some disturbances that happened, irregular periods, clots, all of that happens. And then once you're in the air, then you feel fine. Once you're descending again, then there's turbulence and there is again another sort of restlessness that's created. And that's exactly what is happening. That restlessness is what is being created. And just accepting that this is a part of the phenomenon and then moving on allows us to prepare our mind to accept what is going to happen. So that's number one. Number two is understanding what's happening hormonally, right? If the eggs are depleted, then absolutely we are depleted with our estrogen. And this estrogen, we have known, is a hormone of water element, is a hormone of kapha element. This element was the one that was necessary for our juices, for us to be flowy, for us to be having that amount of, water element within us. Now, suddenly, if this is lost in the body, the kapha element is lost in the body, and we've moved from that pitta element also, we're moving to that drying phase, then you notice that your joints are cracking a little bit because the moisture, the lubrication that is allowing to hold the joints is being lost. And you also notice that you're profusely sweating. You cannot, I mean, we had a workshop that was happening this weekend, and a participant in the workshop was like, "Oh my God, I'm just hot. I'm just so hot. I'm just so hot." And she would take off everything. And then suddenly within 5 minutes, she's like, "Oh my God, I'm so cold." So this is what happens with the temperature of the body keeps changing all the time because it is the pitta that was going out every month in the form of menstruation is now trapped inside. So that is what's happening. And of course, you notice the dryness in your eyes, dryness on your skin. Again, vata, no estrogen. no lubrication. This is like a tagline that we have to remember. No estrogen, no lubrication. And constipation is something that we also experience during this time because there is not a lot of, I mean, again, it's not just after menopause I'm talking about. You experience all of this transitional period is what you experience all of this constipation because the lining, the lubrication has been missing for a long period of time and it's all dried out in your intestines. And the peristaltic movement that was happening properly is not happening now anymore. And you have to work hard to create that peristaltic movement now. It takes a lot of time for that peristaltic movement to be created. So that the dryness inside the body is happening. Headaches will happen. And the biggest thing that is a lot of people talk about brain fog, because again, your lubrication is necessary in the brain as well for not even, I mean, neurogenesis is a long place, but neuroplasticity for us to retain information, you must have some kapha, no? You must have some stable ground for us to retain the information. I'm going to talk for about another 40 minutes, 50 minutes. How much have we actually retained? How much are we able to retain from what we have learned? We're listening to so many podcasts, we're listening to so many things. How much retention is actually happening? Right? That is because our kapha has depleted and the air element has set in, and there's so many fleeting thoughts that are happening, and it's not possible. The ground is not there to hold all of this information. And of course, brain freeze, brain fog, all of this also happens. And you also suddenly feel like you are less immune. You experience all of these, new allergies or colds or coughs. The biggest thing that a lot of people are concerned about is the postmenopausal weight gain, especially at the abdominal girth. And this seems almost inevitable. Again, what's happening? It's because the the food that you eat, it can only be broken down if there is proper lubrication, proper unctuousness to it. If there is no unctuousness to it, then breaking down is not going to be possible. And that estrogen that was giving that unctuous nature is gone, is not there anymore. It's all dried out. And so the food now is not forming into a proper bolus and it's not breaking down properly. And your metabolism has slowed down very much. And because your Kati Pradesha is the Vata, is the pelvic area, is the area where it's the seat of Vata. And that is the area where it becomes much more vulnerable, and your undigested food or excessive fat that is formed is going to be accumulated on that area. And so now that we have learned the reasons of all the different symptoms that happen during the perimenopausal years, we'll talk about what we need to do on how to take care of them. Before that, I'd like to open the floor and have anybody ask questions on if this was okay for you. I know I just blabbered so much in the last 15 minutes, so much. I wanted to ask you if that was something that was making sense for you. Is there anything that you want me to repeat? Or any questions that you have from the previous session that we have conducted, or any questions that you have, any symptom that I have left behind. I might have, left any symptom. But if there's anything that you want me to address, I'm happy to address that symptom before we move on to how to take care of things.
So I've got a couple. The first is endometriosis and also polycystic ovary syndrome. Like I think really both of those would be pretty interesting to hear the Ayurvedic take on as well.
Absolutely. And that I'm going to be talking after we talk about perimenopause and menopause. But I'm going to just write it down just so that I don't forget later. But is there any other thing related to perimenopause or menopause that you wanted me to talk about, any symptoms that I might have missed, I'd be happy to talk about that as well. Post-hysterectomy, perimenopause care. Yeah. Okay. So post-hysterectomy, and a lot of times what happens is there could be cysts, there could be fibroids in polyps, most likely cysts. Depending on the location of them, or the fibroids, depending on the location of them, it's not just possible to remove the fibroid or remove the cyst. And we might have to remove just the uterus or the ovaries and the fallopian tubes and the entire, the total hysterectomy is something that the Western doctors would recommend. Again, I'll tell you on what you must do to avoid it, to possibly avoid it. I will not say to avoid it, to possibly avoid it. But if you have done all of this and yet you're not able to, avoid all of it, yeah, if you not total, and that's why perimenopause can happen. So if you cannot avoid it and hysterectomy has happened, and then later on you experience that perimenopause is happening because of hysterectomy, then we know that a part of us is gone. Body always remembers the trauma of a part that is, gone from us. That's one thing that we have to remember. It doesn't matter what small part it is. So because water holds a lot of memory, and we're made up of 70% of water inside our body, and anything that is removed from the body, it holds that part holds the memory of it. So that trauma is remained. Because of that trauma, there is a lot of dryness that is created. Trauma equals dryness, right? Joy and happiness equals lubrication, and trauma equals dryness. Now that the dryness has happened, it is extremely important to lubricate ourselves externally. Now, HRT, which is hormone replacement therapy, is something that is recommended in the Western world just because they do not have other ways of taking care of how to lubricate the body when dryness is created because of the removal, because of the hysterectomy. Now, that's the reason why estrogen and progesterone as a combination, or estrogen patches, or estrogen is given vaginally, transdermally. In these other ways, it's going to be given to a patient. While I'm not saying it is wrong, you have to remember that these are synthetic hormones, and these synthetic hormones must be broken down by our liver, and we should be able to absorb it properly. Now, imagine if I am talking in my own mother tongue and you're just watching me talk. With my expressions, you probably understand, and with words here and there, you probably will understand a concept of it, but you will not really understand what I'm speaking. The only reason I'm able to communicate with you is because you all understand English and it becomes a concept for you. Now, synthetic hormones are not something that our body understands. It has to guesswork and then break it down. During this process, a lot of debris is created. And this debris is going to be causing another problems, causing maybe your liver is overloaded. There's going to be a lot of digestive issues, metabolic issues that can happen. Now, we always have to look at the risk versus benefit. I am not completely against HRT, and I'm not saying that this is the only modality that you have to follow. I'm only giving you advantages and disadvantages of all of these modalities. And if you're all informed, then it would make it easier for you to make a decision when you have to. So for that reason, I'm not a big fan of HRTs. But what are the ways that Ayurveda allows us to lubricate and allows us to make sure that we are getting all of all of this lubrication naturally? And for that, you definitely would want to make sure this very famous thing, one thing that you can do, if possible, is called Matra Basti, which is lubricating your pelvic area with oil, with medicated oil if possible. If not, sesame oil is also okay. Add a little bit of salt to it, give it warm, keep it lukewarm. And with a catheter, enema catheter, syringes, you're going to be able to administer it, or you can take an Ayurvedic practitioner support, or you can take anybody's, your spouses or your friends, anybody's support to administer. There are big catheters that you can have where you're able to administer it yourself as well. But this Matra Basti is something that will allow. Now, we told that, the estrogen and progesterone is being produced in the pelvic area because your ovaries, your uterus, all of that is located in that area. You are directly lubricating that area by doing Matra Basti, and this is extremely beneficial where you will not be experiencing all the symptoms that we have listed. Number one. Number two is how much sleep are you actually getting? Because if you're not getting proper sleep, then absolutely not possible for us to maintain that lubrication. And are you doing your daily oil massages, which is going to lubricate you entirely? I mean, this is really underrated. And I know those of you who attend every month will feel like, why is she talking about this every month? But I cannot talk any less about it. It is that important. So intuitive, I've learned something called an SLN massage where, you know, with energy, with the flow, you're able to apply oil, like the intuitive way of applying oil, so that you're moving energy within the body because there's a lot of stuck energy that we feel in the body. That's where lymphatics, somatics, these are the things that has come up now, right now, because there's that stuck energy that is present. So you're allowing that circulation to happen so that any stuck energy, any stuck lymph, all of that is being moved. And you're allowing for lubrication to happen as well. So circulation and lubrication is possible with proper abhyanga. Again, use sesame oil. And I always talk about chanting and listening to Vedic hymns. I cannot tell you how much it opens the chakras also. When this, and I've actually met a client today, and we've told her a hymn. She's been practicing it, and she comes for a different reason, not perimenopausal or hysterectomy considered related, but the shift that we have seen in her, because these ancient chants have passwords in them in such a way that it opens up any of the stuck energy in the body. And I guarantee that you practice it and it's going to be making a difference for you. And definitely learn something new every day, keeping your, brain active. And mainly, I always talk about eating cooked, fresh food, right? These are all the things that you would want to follow. But again, if you give me specifics, I can tell you what perimenopausal care is, something that I can tell you like a generic way. If you give me like a specifics, if there's a specific symptom that you want to talk about, then I can give you specifics of that. But these are like the general ways that you want to take care of yourself. Yeah. Would you also please address what one can do if we have not done any of this and menopause has happened? Yeah, I know, because Shashi, for people like me, I talk so much about pregnancy, and when people come to me pre-pregnancy and antenatal care, I'm so jealous because I've never known anything of that. Postpartum also, I've never known anything of that. And I feel so jealous that but then I'm glad that I'm practicing that now. I did not do any of the post-pregnancy or postpartum care after my two kids. Now, going back to menopause, it is okay. You have, like I said, you have not missed the boat. Probably missed it, and probably there was a rough ending. You have like a rough landing, but you landed somehow.
Okay.
And once you've landed, you look at which area is dried out most. Most
Hmm.
of the times, you would know that there is a vulnerable spot in the body or a vulnerable area of the body that is much more affected compared to the other areas. Because, and that's why these are all widespread, no? Like the perimenopausal symptoms are widespread. They are not similar to, for all of us. And that is because of the vulnerable spot of the body. If we know what that vulnerable spot is, then we can provide care to that specific spot. For example, if you're experiencing weight gain, then we know that our metabolism has reduced. We know that our dampening of the Agni has happened. The Vayu that has increased, the air element that has increased, blew away all the digestive enzymes and dried out all the enzymes. Imagine all of these, pepsin, trypsin, and all of these, the probiotics, they survive only if there is that moisture. No, if there's no moisture, they will not survive. So this air has blown all of this away. And we know that there's suddenly a lot of weight gain happening because of less metabolism. And and now, because this air is blowing, you feel that fake hunger as well. So that's like a story where you feel hunger, but you're not digesting what you eat, and that just stays there. And we all get frustrated. We're like, I'm doing exercise, I am eating less, I'm watching my calories, I'm sleeping well. What is going on? I am still not able to shed that pounds that are that I've been gaining, right? So that is something that a lot of us feel. Again, this is the most common thing, and that's why I thought that I'll address that particular thing. So, for that also, contrary to what we experience, we always are like, well, I want to work out more so that I am going to be able to burn those calories. No, you're drawing even more. You have to be very, very careful, because if you are working out much more beyond your capacity, you're drying out more. Then a lot of us are like, oh, I don't want to eat ghee, because if I eat ghee, then that will increase my cholesterol. My cholesterol numbers are already high because they're high because my metabolism is not high. And there's a fear that if I eat ghee, then my cholesterol numbers will increase. And then we don't eat ghee. And we are like, oh, salads, because they are good fiber. My constipation is there. It will push out everything. I'm going to include salads in my diet. And I am going to be watching the amount of calories that I'm going to be eating, because I am going to be starving myself. These are usual suspects, usual things that a lot of us do because we become a bit desperate. We're like, let's just do all of it. But if you look at it, and if you have seen women who tried it, not a lot of them were successful. The reason being that it is contrary to the phenomenon that is happening inside our body in that particular age. If you do all of this in your youth, I'm not saying that you're not youth when you're menopause, not at all, because I told in the past that this is another like a teenage, because you melt, your heart melts, and you are able to accept anything and everybody. You're like the things that you held on to in the past, you're like, well, that's okay, it's okay, Debanti is my friend, she can say whatever she wants to. So things like that happen to us, we melt at that time. So but if you were to follow all of these excessive exercises and less calorie intake during your 20s, then that works, because you have enough cushion at that time. You have enough lubrication at that time. You have enough kapha at that time. Right now, you don't. So, lubrication is the most important thing, which is why I am talking about, which is why I'm not talking. Ayurveda talks about lubricate all your orifices. Karna Purana. Shiro Abhyanga. You see, my hair is full of oil today. I'm not shy to come in front of all of you, and this is how I did all my consults today. So Shiro Abhyanga, Karna Purana, pouring oil into your ears. This is going to be pacifying your vata. And remember, what is that axis that is determining all of these hormones in our body? The hypothalamus, pituitary, and adrenal axis, which is all present in your brain. And that is balanced if you are going to be balancing your ears with vata, where the vata is balanced. You do your nasya and no nasahe shirasodvaram. You're going to be able to access your brain and your hypothalamus is balanced. Because your hypothalamus is balanced, your pituitary is also balanced, and it knows what it needs to do to maintain that homeostasis in your body. And you're applying abhyanga all over your body, and you're going to be, we're saying enemas, which is matravasti, inserting oil into your rectum. There is also something called uttaravasti, which we don't do that here in the United States. I have not been trained, but we have our doctors in the clinic, then they can do it, called uttaravasti, which is sending oil through your vagina as well, because vagina is also completely dried out at that time. And you do that. But if that is not possible, the best thing, if there is dryness in the vagina, is something called pichu, which is you can get like a fresh cotton tampon and you soak it in either ghee or sesame oil or even dhanvantaram tailam, and remove all the excess oil, insert it vaginally and leave it overnight, and there's a lot of lubrication that is created. Add 1 to 2 teaspoons of ghee and happily eat your meals. Happily go out with your girlfriends. Embrace your body. And then you will see a shift happening. Because the much you try harder, you're like, I want to do this, I want to do this, and you're just drying out yourself even more. You relax, and there is a lot of shift that happens in your body. And that is going to be automatically allowing you to shed that extra pounds in the body, right? So that is something that I would recommend menopausal. Of course, how many ever abhyangas you want to get done? Our therapists are amazing in getting those abhyangas done, and you can absolutely get those abhyangas done, and you do them at home yourself as well. Yeah. How often do we do the oil enema? Okay, so it all again depends on the amount of dryness and depends on your prakriti at this particular point. But if I have to give like a blanket statement, and that is not going to be something that's going to be bothering you, I would say you can insert 60 ml of warm sesame oil once a month is not going to be harming you. Regardless, again, remember that you have to eat, you have to have full stomach before you apply oil enema. You cannot be applying it on empty stomach. That's one thing that you should remember. And oil retention, it depends on how much time. If you want to ever get it done, I would recommend that you get it done with a expert once, so you know how it feels, and then you can do it at home yourself. Yeah. Debanti, you had a question?
Yeah, you answered the one I had in the chat when you talked about ghee. But the corollary to that is that in the West, they talk about preserving muscle as you get closer to menopause, and so they actually tell you to lift heavier and things like that. So you are basically saying the opposite then, correct?
I am not. I am also saying that you must lift. It is important that you do strength training. And this is something that we spoke in our last workshop as well, that strength training and lifting is important because your muscle is the tissue that is right after your blood and right before your fat. It's like a block between both of them, and it must stay strong so that it can protect you. However, what I am saying is do not do it beyond your capacity. There is a capacity that we all have, And if you do it beyond your capacity, then you are borrowing from the future. You must listen to your body. When you sweat from your forehead and when you're breathing from your mouth, then that tells you that you have reached half your capacity and you must either stop or reduce the amount of workout that you're doing and continue it at a later time. And then you have to slowly increase your endurance. I myself am strength training, and it's important that you do your strength training, but you must do it, make sure that you're also oiling, make sure that you're also taking ghee, make sure that you're sleeping well, make sure that you're nourishing yourself well. Do not be depriving and compromising yourself on these essentials in the name of working out. Because a lot of times people are like, oh my God, there goes my workout. When they're eating something, they're like, oh my God, there goes my 100 calories or whatever, right? That's what they equate it to. But that's not true, because this is nourishing you in a different level, and your workout is allowing you to kindle your digestive fire. So those are two different things. All I'm saying is while you're lubricating yourself, you want to also make sure that you are working out and gaining that proper strength.
Okay, so it's still okay to be active and push yourself a little bit, right? Like
Absolutely. And I always recommend, and you want to push yourself a little bit. Little bit is the key, not a lot.
Mhm.
While you're following all of these other things. Yeah. And make sure that you are breathing while you're exercising. You cannot be like, and then exercise, because that's what we see a lot. You want to relax and you want to be creating that breath while you're exercising. Yeah, absolutely, Shashi. I'm glad that you enjoyed this. So that is about, I mean, I know the question that Mridul asked segued into how to take care of perimenopause and menopause as well. So if we are done with questions of this, I will go ahead and address endometriosis and PCOS as well. Endometriosis, again, this is a layer that is for, so again, every month there is estrogen that is released first, it rises. And once we reach a certain stage, estrogen is like, imagine it as like a clay that is like um, you know, a clay before we're making a pot. It's like the wet clay. Imagine that as a wet clay that is being formed. Now, this wet clay is now going to be attached with progesterone, and this progesterone is allowing for it to become into a form so that a pot can be formed every month. So that's a phenomenon. So this is like the loose liquid that is being formed, the estrogen, and that the form is happening because of the progesterone. And after that, if the pregnancy happens, if there is a conjugation between the ovum and the sperm, then there is going to be an embryo that's formed and that is going to be implanted, and all of that 9 yards happen. Now, if it fails, if the sperm does not attach to the ovum, then the layer that is being formed in the uterine lining, in the endometrium, to save that embryo is now shed, right? This lining is saved if the embryo conjugates with a sperm, or this lining sheds if the ovum, if it does not have to save the ovum anymore, right? But what happens is this layer that is being formed in the uterine cavity, because of excessive vata that we carry, is going to be pulled to different areas of our body. It does not remain in the uterine cavity anymore. It can go into your abdominal cavity. Sometimes I've seen in rare cases that it even is even seen in the chest cavity. This endometrial lining, which is supposed to shed out, instead of it being shed, is pulled to different areas of the body because there's a cyclone that's created in the body in the form of vata, for all the reasons that we have discussed in the past. We know that vata aggravates when we exercise too much during periods, especially because the air is supposed to go down, but we've created air opposite way, and that can create you did not sleep well, you travel too much, you're speaking nonstop, you are having excessive stress that you're not able to get out of your head, you're angry, you are not eating according to your capacity, you're not including any lubricating food. So all of this can increase the air element, and instead of the uterine lining staying there, it's being pulled to a different area. That is one phenomenon. And this uterine cavity, instead of being shed, is just piling up. And when it reaches into different areas of the body, then your abdominal cavity is like, what is this? I don't know what this is. You don't belong here. Your chest, your everywhere it goes to, it tries to discard it, but it's not knowing how to be discarded off the body. That is when pain forms, and that is when accumulation of it happens in the body and pain occurs. So again, what do we need to do? Taming the vata. Always prevention is the key. Vata is known to be your protector and your biggest destroyer also. So all those things that we spoke about earlier last time when we spoke about what are all the rules and regulations that are mentioned during menstruation must be followed. And if that was not followed, then absolutely your vata aggravates. And all of this can happen. So the treatment of this is again pachana, which is allowing the undigested layer to be digested. And again, lubricating the vata and allowing the vata to flow in a normal direction so that it is not pulling the endometrial layer. And again, basti. Here, not just regular basti that I told you, that lubricating basti, you have to get it done with an Ayurvedic practitioner. It is called yoga basti, where we give you decoctions also to remove, because it has reached into different parts of the body now. Now, in the Western world, the only way that you can take care of it is surgically remove it. But instead of surgically removing it, we send decoctions inside your body and allow for the cleanse to happen. So that is how we take care of endometriosis. Let's see, there are some questions. Are kapha promoting lubricating foods recommended for lubrication, or abhyanga and oil enema along with sleep and workout good enough? Also, in general, is there a recommendation of some specific dietary support? Okay. So I wouldn't say kapha promoting, but definitely lubricating foods are recommended. Also, along with abhyanga, oil enema, and sleep, mridul, and workout. Because if you're not including that in your diet, your food is the one that makes your tissues. And snehasaram ayam purushaha. It is important for us to know that the language that all the tissues speak in is lubrication. And that lubrication is provided by the food that we eat. So, the kind of foods that I recommend are root vegetables, sweet potatoes, gourds, and all the squashes, even pumpkin. But usually I don't want you to eat lots of pumpkin. It can get heavier as well. But in the season, you can have a little bit of that. And asparagus is actually very, very good. It is similar to something called shatavari in Ayurveda. And you can roast asparagus, you can make a soup out of it, you can make a curry out of it, and you can include asparagus in your diet. These are the ones that I generally recommend, and include good quality fruits also in your diet. Like right now, persimmons are in the season, so include them. Figs are very good. Pomegranates are good. Grapes, raisins. These are all very good source of how you're going to be cooling your body and allowing for natural lubrication to happen. And of course, the ghee that you want to include. But remember that I'm not asking you to load with a lot of, kapha inducing foods without knowing what your digestive capacity is. Again, when I'm making a blanket statement, it's extremely important for me to give you this kind of a disclaimer that we always should look at what our digestive capacity is, and that is how we are going to be providing that kind of foods to the body. So adding proper spices, not the spices that are very, very spicy, but adding, like the cumin powder, coriander powder, dry ginger powder, asafoetida. All of these are important so that the breakdown of that kaphagenic foods is going to be possible, and that lubrication is going to be absorbed into your organ. Even your organ will not be able to function well if it's dried out, if it's dry. And how is it going to be absorbing things? How is it going to be absorbing all the vitamins and the minerals and everything? So important to lubricate everything. That's the goal. And lubricate responsibly is something that I'll say. Yeah. Good. Now, PCOS. So what is happening? There are a lot of eggs that are present in our body. We spoke about it, how at birth we have eggs, and then at puberty, all of these eggs fight, and only one ovum, is going to win, and it's going to mature, and it's going to be released. Now, what's going to happen in the PCOS is multiple eggs try to mature, and they will not mature fully. They will just stay there. What happens is once some eggs try to mature and only one egg wins out of it, all the others are supposed to rupture and they're supposed to be sent out of the body. But in PCOS, immature maturity, I use the word deliberately, immature maturity, which means that they mature but not to the fullest capacity. And they are not going to be able to also lyse, which means they're not able to disintegrate by themselves, and they stay there. Which means your period is usually delayed because of this reason, because there's not a one ovum that is fully matured, and there are a lot of accumulation of eggs that are not lysed and that are not matured, and they just stay in the body. And this is when a lot of irregularity happens. You bleed probably once in every 3 months, and sometimes every month, sometimes every 45 days. And there's a lot of this that happens. And for that reason, because this is immature eggs that are present, you experience all of these symptoms of hirsutism, unwanted hair, and then hair loss, because there is immature hormones that are being released, and they are acting in different areas of the body that we don't want them to be acted on. So what do? The biggest thing that I tell for all of my PCOS clients is exercise, especially in the morning, especially during the kapha kala. This will allow for your body to create that breathing space so that there's not like that congestion that is happening. And that breathing space will allow for the proper eggs to mature and allow it to go out of the body. So number one, we have to reduce the tendency of holding in our body. We have to allow for the disintegration to happen. And for that, we have to make sure that we exercise in the morning, like rigorous exercise for these kind of people. Especially this is seen in a lot of kapha predominant people is what we see this in. And making sure that if they are including a lot of oily fried foods, sweets, we want to reduce them all. We want to include only bitter, stringent kind of foods. And for them, scrubbing is recommended than lubrication. Again, this can be a Vata Kapha kind of condition also, and it can vary depending on the condition. But generally speaking, dry scrubbing is going to be beneficial, where Udvartana is something that is beneficial for them. And in Panchakarma, what we do is we do something called Vamana, which is giving you medicated ghee for some period of time and then creating this therapeutic vomiting, so that excessive kapha that is holding on to all of this is going to be removed, and you will create that breathing space So all of this will not happen. And we'll give some, Pachana Deepana Dravyas so that that disintegration happens. So that's a stark difference between endometriosis and PCOS. Yeah. So that is about all women health. Any other questions? I know we have a few minutes left, but I would like to address any of the questions that you have. I think it's a good discussion that all of us had today. And I hope that we're able to practice all of this on a daily basis. Yes, Shashi?
Any specific type of exercise you recommend in the morning?
Um, I would say it is necessary that you do both cardio and strength training in the morning, especially if you're asking for PCOS, I would say cardio. But if you're specifically asking for perimenopause and menopause kind of a situation, then
Mhm.
breathing into the area and strength training is more important, but you want to include aerobics and you want to include the kind of cardio as well. In Ayurveda,
Mhm.
Vyayama is known as Ayasa Janakam. Anything that is creating that ayasa, that increase in breath, is considered as exercise. And
Mhm.
that is something that we ask you to do. So you're increasing, you're creating that movement in the body along with strengthening. So
Okay.
if I were you, I would do 3 days of strength training and 3 days of, or you could do like a 20 minute of aerobics or 20 minutes of cardio and then move to strength training later.
Thank you.
But I would always recommend doing it in the morning because that's the kapha kala and that's the time that is beneficial for the body, and our body is able to do it the most. If you don't have time, then you can do it maybe in the evening, but not close to sleep at all because that activates you and you will not be able to sleep. And I would not recommend that.
Thank you.
Absolutely. Okay, mood swings during perimenopause. Like I mentioned, it is always about stabilizing your hypothalamus, pituitary, and adrenals because adrenals is something that is fired when all of this happens. It's like you have your prefrontal cortex. This is where all the rational kind of answers are. I want to be nice. I am in front of people. I know I have to talk what I have to talk. So your rational brain is telling you, Manju, you have to behave this way. This is, I mean, audience are, all of this is coming from your prefrontal cortex. But your brainstem and your amygdala is holding on to the emotions and they fire if you are overcome by emotions. What happens is this is all blocked when you're overpowered by emotions, and your amygdala suddenly is like, it's okay, I'm fine. I don't care what's going on, and I'm going to be using whatever language I want to. I don't care whatever is happening in front of me because your prefrontal cortex is now blocked because of that emotions, whatever is happening. So we want to train the soldiers, we want to train them before it happens. It is extremely important that we follow our breath, our long forgotten breath. There's no other magic. We teach, of course, Bhramari and Shitali, Shitkari, and even alternate nostril breathing, where you are allowing the pituitary to be regulated properly and making sure that you're using the rational brain. So all of that regulation happens if you practice your breath work on a daily basis. Now you cannot say that I'm going to be stressed out today, and today I'm going to be practicing it. And it's okay to do that also, but it's not going to be as effective. And that's why breath is a powerful tool that's going to be benefiting you in handling your mood swings. Number two is Shiro Abhyanga or Shiro Dhara. This is something that also, because this is where a lot of marma points are present and they all open up when you do shirodhara. This is where we do the shirodhara, and that opens up a lot of things as well, and that's lubricating as well. So a win-win situation in helping you with your mood swings as well. And giving you some cooling things like Shatavari Kalpa is something that we also tell a lot of females to consume. Shatavari Kalpa, I'm going to be just writing it down. It's a formulation made out of shatavari. It's a sweet one that you can consume as a rasayana in the morning. Again, this is also going to be helping you regulate your brain. Or taking medicated ghees like Brahmi Ghritam, if you're able to handle that amount of ghee. I mean, just take half a teaspoon or 1 teaspoon in the morning on empty stomach, which is like a rasayana as well. That also is going to be regulating and allowing you to lubricate your all of your white matter and allowing you to make that decisions. So it's not like a one answer, right? Because we want to be using all the tools that are possible for us because we never know what tools come in handy when things are happening. So especially if you're experiencing mood swings, you want to include everything possible, so that you're not being a puppet of your emotions. Yeah, and of course, all the other things that we spoke about also make sense, but specifically for mood swings is what I've mentioned. Abhyanga always in the morning, never before bed. I know a lot of people do it before bed. Abhyanga before you can do it for your shira. I mean your scalp, your feet, and behind your ears. This you can do it before bed. That's going to be allowing you to sleep wonderfully well. But your entire body, I would not recommend it before bed. I would always recommend it in the morning. Right in the textbooks, it is recommended before your exercise. Honestly, I don't do it. I don't want to go in oily clothes and do that. So I don't want to slip and fall. I don't want to do all of that. But I do my exercise, Abhyanga, just applying oil all over my body before I go into the shower. That's all I do. I will not be able to, I don't have time to sit down for 15 minutes. So that is recommended in the morning.
I love that one of the benefits of this is that as you get older, you're supposed to basically eat more ghee to like lubricate yourself. Nice.
I wouldn't say more ghee, but again, depending on what your capacity is, we have to. I always give that disclaimer because then later on everybody's like, "Well, you asked me to drink ghee, and I increased my weight. What's going on with that?" Winter drinks apart from coffee or tea, your blue pea flower, Shankhapushpi tea, extremely good. Chamomile tea, extremely good. Ginger honey tea is extremely good. So these are all the things that you can include. Licorice tea is also good, actually. Okay. Amazing. Thank you so much for joining this week or this month. And I will see you all next month. I hope you have a wonderful Thanksgiving, and I'll see you all next month.
Thank you, Dr. Manju.
All right. Thank you, Bhamini.
Thank you.
You take care. Bye.